Hey, I'm Rachael Sood. I'm a diabetes nurse practitioner and I own a practice in South Louisiana. It's called the Diabetes Collective. We specialize in all types of diabetes and especially providing care to people with diabetes or at risk for it. So I have a huge interest in the type 1 space, especially when it comes to our topic today. This is huge. This is huge news. When I woke up and saw this news, this is the hugest news probably for this entire year. People that get diagnosed with type 1 diabetes have a complete change in lifestyle. They have to make so many extra decisions. They are dependent on insulin. They are traumatized. They are most often diagnosed in emergency rooms. Many times when we're talking about kids, people don't recognize symptoms early because kids are kids. They don't really complain. They're just having fun. Oh, I'm hungry. I'm dehydrated. Oh, I'm, always sick, but they just don't complain. They don't recognize things. And we're definitely not getting to our children as quickly. We also have an issue with just access to care. In pediatric clinics, you're seeing 25, 30 people a day, sick visits, and it's really hard to keep up. So like these people just go under the radar. And so now that this indication is open, I'm hoping that it opens up the opportunity to maybe you would want to screen patients to see if they have type 1 diabetes, even early stages, because we actually do have a treatment for them now. Whereas before, yeah, we can know, and I want to know, but I think maybe that was a barrier in some pediatric clinics or time, that, oh, we don't have anything to do about it except just insulin. So why screen or why recognize? I don't know. I don't know what the, you know, gate is to, but I'm hoping this opens it. I'm hoping that this indication increases awareness that we do have a medication for this. And just, going to the last point, I kind of jumped at the gun, but hey, like now we have a medication. So let's screen and see, because if they are, then we know, and then we can get them, this treatment if they desire it. Now we actually have another option to give them instead of just, hey, waiting or referral to clinical trial, or just let's wait so your blood sugar gets high and you need insulin, come back when you need insulin. I hate that phrase, and I hope we start seeing and hearing less of it. Factors to consider for TZIELD. So anyone that has type 1 diabetes stage 2 is going to be a candidate for teplizumab or TZIELD, a CD3-directed monoclonal antibody. This is a medication that we make sure that someone is in good health. Obviously, when we give the medication, we do screen people to see if they have any like really bad active viral infections or things like that. It's very, very rare. So most people that are in type 1 stage 2 are candidates for this IV infusion. I think we're not ready. And I don't want to say that, but I'm going to be honest, because we are seeing an increase in type 1. We are seeing an increase in autoimmune diseases just across the US, here where I am, and across the globe. We are seeing more autoimmune. I think more people are getting more aware of immunology, and we're starting to see that branch off just in the endocrine space and really in the primary care space. People are getting more interested and invested in it. I hope this FDA approval kind of kickstarts that, hey, like there's a medication for this. Like there was a reason that this came about. There was a reason to study this. There's a reason to screen. There's a reason to give people time. There's a reason to recognize and see that, hey, like if we want to keep kids out the hospital, if we want to give mom a few extra years, even if this delays progression for a few years, maybe it doesn't hold the beta cells completely, but if it buys time, that time is so, so precious, and people deserve that time. Kids, moms, parents, families, they deserve this time to not have the burden of having to take insulin and watching their blood sugar 24/7.